one of the biggest discoveries is actually this tiny. See how small that is? This little chip may be the next big thing. And it sounds like it's right from a sci-fi movie, but people all over the world are implanting these into their wrists. So I asked my producer, Dean, to find out more about this cutting-edge technology and what it could mean for your health.
Honor a physician with the honor due unto him for the uses which ye may have of him, for the Lord hath created him. From the Most High cometh healing, and he shall receive honor of the King. Ecclesiasticus chapter 38, verse 1 and 2. Shalom. I want to start off by giving all praises, honor, and glory to Yahweh, Bahasham, Yahushai, Bahasham, Rachak, Kodash. Double honors to our venerable apostles and elders of Great Millstone who rule well. Peace and blessings to the Lord's elect, the house of David. All right, so Brother Haran coming back at you with another lesson, Lord willing to be edifying and uplifting unto the elect. All right, and I believe today is the 10th of November, 10th of December, 2025. All right, and I want to jump into this real quick. I have a couple of articles, and as I glanced through it, the Spirit prompted me to do a quick lesson on it, just to pick out a few points. All right, now today, I'll say earlier today, I saw that they're saying that they were going to bring back mask mandates, all right, in several states, including New York. So we're pretty much at that time where they're about to roll this thing back over again. Okay, and we've been saying that they're going to bring it back again, but this time it's going to be the official push to merge in biometrics with health. Okay, the whole concept of One Health and so on and so forth. Now is the time for them to make their move. Okay, and I have a few articles here, but the first one, it says, Quademic surge forces schools to close and triggers mask mandates across the U.S. Okay, so here we go again. It says, doctors across the country are warning that hospitals may face a difficult winter as several highly contagious viruses surge at the same time. Okay, so from 2020, when we had the first outbreak, the whole demic situation, which was all a pandemic, which was all fake, to fast forward now, you notice there wasn't no pandemic after that, right? It just pretty much things went back to normal. The only thing they kept pushing was, oh, they got variants and Omicron and this and that. But they never really brought back those mandates, like mask mandates and all of this. Those things kind of did away. They went away, right? Because for so long they said that, if you get a flu, right? People are getting sick, getting the flu. They weren't wearing masks no more over the past 3-4 years, right? They just kind of left it to go back to normal again. Like how things were before they started with this propaganda of, oh, if you have a sniffle or you sneeze or you cough, all of a sudden you have COVID, so you have to go get tested or stay home and quarantine. All that bullshit was made up. All right. Now we're finding out, everyone is finding out that it was all made up. But even though people know that it was all made up and it wasn't real, right? They're going to do the same thing again. And this time it's still going to work because these people are too stupid to realize what the hell's going on. Okay. They're sheeple for real, for real. All right. You're going to see them wearing masks just because they were told to wear it, not because they use their own brain to assess the situation to find out, maybe it's better if I do it or maybe if I don't do it. Nah, it's just because the doctors or the experts told them to do it at a certain time of the year, they're going to do it. Okay, so leave it to them for them to do that. All right, it says a sharp rise in H3N2 influenza. All right, H3N2, new CV19 variants, RSV and norovirus is creating what many experts describe as a multi-virus wave, increasing strain on already crowded emergency rooms. Last time I checked, ain't no emergency rooms that's crowded, bro. All right, that shit they tried back in 2020. That shit, hey, it's not gonna work this time, bro. All right, well, not on everyone, I should say, because you still got dumbass people out there. All right, but they said it already crowded emergency rooms. Who is crowded with who? With what? People? Just beds? I mean, what are we talking about here? It's crowded. Where's the crowd at? Last time I went to an emergency room, they had you sit there for 3-4 hours just so they could check your blood and check your temperature and what else? What else was the other one to do? Oh yeah, right. Do a COVID test. That's it. And then you come back with $1,200 bill, all because of what? That's why we start off with Ecclesiasticus, the 38th chapter, going into honoring the physician, because really, if you follow the truth, all right, the true doctrine of Yahweh Ba'ashem Yahushai, you know how to take care of yourself. Okay, you're not gonna fall for this bullshit ass physician of no value ass shit that they keep coming out with. You're not gonna fall for that. All right. They're going to come up with the hysteria. They come up with the propaganda, all these different things, fear tactics. You're not going to fall for that. Okay. Because you're going to understand that no matter what illness may be out there, the Lord is protecting you from it. Number one. Number two, even if you get it, it's not going to be as crazy as they say it is. All right. Because we all went through that whole CB shit when it first came out. Whatever it is that was in the air, there was something going on. All right. And we were all catching it. You lose your taste, your sense of taste, smell, all that shit. We went through that. But when we bugging out, say, oh, I need to go take a vaccine because you just do your C ragamuffin, mean tea killer. You drink that shit. Boom. A couple of days, you back to normal again. All right. So we're not trying to hear none of that shit because we believe on Yahweh Bashim Yahweh Shai. He gave us the herbs to be able to take care of ourselves. All you got to do is just study up. If you know how the body works, you can pretty much treat every single, or cure, not treat, cure every single illness or disease your body may face or go through. You don't need no fuck ass doctor to tell you to be on some pills forever. Like, nah, you don't need none of that shit. Okay? All this synthetic ass bullshit that you go to the hospital and then it's like, oh, once you get on these blood thinners, you on that for life. Who the fuck came up with that? And prior to all these doctors becoming a thing, before the big pharma corporations became a thing, what were our ancestors using before? All right, before the Rockefellers turned all the medication to synthetic drugs, what the hell were we doing before, man? Right? So you got to go back to those things. You got to go back to the roots. You got to go back to your herbs. Study up on your herbs, man. All right? Study how the body works. Okay? And then go according to that. That's what works. All this bullshit they pushing, it doesn't work. That's why they have to coerce you to think that it works. Okay? Talking about build trust. Get the fuck out of here, man. So continue. It says, health officials report that the H3N2 flu strain is spreading earlier and faster than expected, leading to unusually high hospitalizations for this point in the season. And what is going to be the cure for all this shit? Is going to be some type of technological shit. Watch, they're going to push technology to the fullest. All right, that's the only way. That's the new thing, the new way. You know, just watch. We're going to get there. It says, at the same time, CV-19 cases are climbing again, driven by new mutations that appear to spread more easily, even among people who have previously been infected. All right. So that's, again, nobody over the past 2-3 years, nobody's really been bothered with that shit. Nobody really says that, oh, you got corona. Oh, you got COVID. Oh, it's like people are just going about their lives. It's not until now that they're going to start pushing up that propaganda that people are going to start becoming conscious about it again. And they start acting all stupid, wearing a mask in their own car by themselves. That shit is crazy. All right, so continue. It says, RSV, which is particularly dangerous for infants and older adults, is also circulating widely and contributing to the number of respiratory cases filling clinics and hospitals. Adding to the burden is norovirus, a highly contagious gastrointestinal virus known for causing severe vomiting and diarrhea. Doctors say the combination of these illnesses is creating a perfect storm. That's what doctors are saying. It's a perfect storm. I don't know why you call it that, but okay. For healthcare systems, emergency departments are reporting longer wait times, reduced bed availability, and an increasing number of vulnerable patients needing respiratory support. And look, if you're smart, right, do not take your ass to these hospitals, bro. If you're gonna, you have a better chance of survival and living than to go to these hospitals. They're gonna kill you. Do you remember that video that came out just under a month ago, probably a couple of weeks ago, where you had this Jake woman that was in labor, and she goes to the hospital, and they treated her like shit to the point where her husband delivered. All right, her husband delivered the baby while they're in the car. Okay, I guess they wouldn't take care of her for whatever reason. I forget what the story was, but she's breathing heavy, sitting in this in a wheelchair, breathing all heavy and shit. And the nurses are just there, like, okay, just sign this. Do you have this paper? Do you have this information? And she's like, yo, my baby the water broke. Like, what's good? You know, that's an emergency. That is an emergency. Not no, I got a flu. Oh, I got a cold. I need to come. That's an emergency, bro. That's not a fucking emergency, man. All right. You stay your ass home. You're going to be all right. Just drink your teas. All right. Number one, you got to fast and you got to pray. Those two things are like your biggest thing. Fasting and praying when your body is ill, it helps your body to rebuild. All right, you go on a 72-hour fast, no food, no water. Your body is going to rebuild and repair. All right, it's going to help you with killing all those parasites. Most of the illnesses people get is all parasites. All right, it's all parasites. If you do a parasite cleanse, you're going to see the difference in your body, your skin, your brain, how it works, right? Your sleep patterns, right? Your libido. All these different things are affected by parasites. Okay, and that's something that these medical institutions, these pseudo-scientific, pseudo-physicians, they're not going to tell you that. They're not going to tell you that. Okay, because they want to pump you with all these synthetic poisons and then keep you on that shit forever. All right, and you never get cured, because what they say, a patient cured is a customer lost, right? That whole ass shit. It says right. So going back to the point I was making before I finish this article here, right? They are manufacturing this crisis, this healthcare crisis. They are manufacturing that shit. Because if they wanted to take care of people, they would actually do it. But right now, they got all these underqualified, nonchalant ass people in these hospital fields. They don't know what the hell is going on. They're just told to do one thing, which is go according to what the doctor says. Don't do anything else outside of that. Don't deviate from the plan. Just stick to what they're telling you to do, and that's it. Which is all BS. Okay? The whole concept of the Hippocratic oath that they take, right? Doctors, they all do is falsify, lie to people, kill people. The most expensive healthcare system is the worst in the world. You pay for health insurance, and then when it comes time to use it, they charge you way more than somebody who doesn't have insurance. It's a whole system that's is built on fraud. And the more it gets exposed, the more people get agitated by it. 2026 is going to be a heavy year, man. Heavy year. Okay, it's like a culmination of everything that we've been talking about: financial problems, health problems, food scarcity, violence in the streets. You name it. All right, the takeover of AI, making people's lives even more of a living hell. Okay, uncertainty every single day when you wake up is going to be some new shit. That's called trouble. All right, trouble in the mind, trouble in the flesh. Okay, constantly you're being perplexed all the time. Every single day is something new that you got to worry about. That's what these devils are about to unleash in 2026, man. Okay. And by the middle of 2026, you're gonna see them start pushing heavy that MOTB concept. Okay, they're gonna start pushing that shit because now they've laid the groundwork. It's not about they've laid the groundwork for it. And now you're about to start seeing these people, RFK and Dr. Oz and all these people start pushing because that big, beautiful bill is already in place. So that's all they needed. They needed the legislative part to be in place. And once it's in place, all the pieces are going to start moving accordingly. All right. I told my brother this. I said, watch till Trump gets in. After a year of him being president, you're going to see things move faster, much faster. All right. So continuing, it says, physicians warn that even a modest rise in cases could push hospitals into crisis levels of overcrowding. That's not true, but that's all part of the fear tactics. Okay. It says health experts are urgent. And I'll tell you this, you go to a hospital, you go to the emergency room, there ain't no emergency going on, but they'll have you sitting there waiting for hours, bro. That's my thing. You call it an emergency, right? But yet you treat it like it's some casual shit. Ain't nobody moving with any sense of urgency, bro. You get there, you might be in pain, but you get there and the way they treat you is like, yo, man, the whole system is fucked. That's why you don't waste your time going over there, because they're not going to do nothing for you. Trust me. All right. Just do the old school way and figure it out. Let the Lord deal with it. All right. It says health experts are urging the public to take preventative steps to reduce the spread of illness. This is what they're recommending: staying home when sick, practicing good hand hygiene, and using masks in crowded indoor settings, especially for individuals at higher risk of complications. Okay, so that's what they're recommending for whatever illnesses that they just pronounced that's about to take over the whole world, right? That, well, we should all be scared. This is what you could do: just stay home, practice good hand hygiene, and use masks. Those three things are going to help you. That's what they're saying. So let's wait till a couple weeks or months down the line when they start pushing heavy that, oh, the only thing that's going to help, forget about the staying home and, you can stay home, but you can still get sick. You can still wear the mask, you still get sick. You can still practice hand hygiene, you still get sick. So now, Vanessa, now this wearable track technology that we're going to be able to watch and see in real time, how your health is improving or whatever the case may be. Because that's the next thing. All right, that's the next thing. It says, while many people with mild symptoms can recover at home with rest, fluids, and over-the-counter medications, doctors emphasize the importance of seeking immediate care for severe symptoms such as difficulty breathing, persistent high fever, dehydration, and worsening respiratory distress. All that shit could be cured at home, bro. All right, we could do remedies on that for you, even though this is not health advice. We're just letting you know that, all right, I'm letting you know that there's ways around that shit. Don't take your ass to the hospital, bro. Stay away from those hospitals. If you want to live, stay away from them. All right? Because this is the next thing that they're coming down with. All right? The WHO that. All right? They're back in the frame because now is the time for them to shine. The WHO outlines global plan for digital health tools, which includes AI and wearables. Right on time for this new so-called quademic. Right? In a sweeping new initiative, the World Health Organization has unveiled a global plan to accelerate the adoption of digital health tools, from artificial intelligence, AI, to wearable devices, aiming to transform how healthcare is delivered worldwide. Okay? Worldwide. You see, the plan reflects growing recognition that digital technologies can help overcome long-standing barriers to care, especially in underserved regions. According to the WHO, these tools can enhance disease prevention, diagnosis, treatment, and follow-up, reaching more people and improving outcomes. We know that's bullshit. It says, the strategy places particular emphasis on AI-based software and sensors embedded in everyday devices such as smartwatches or fitness rings. So the word embedded, when I think of embedded, I think of C-hips. That's it. I don't think of wearables. I don't think of phones. I just think of, what are you embedding? You're embedding something underneath somebody's skin. That's the ultimate goal. So I skip all the riffraff and the fluff, right? All that fluff. Oh, the wearables and the smart technology. No. What's this all leading to? So let's prepare for that, right? Let's skip all this bullshit and let's get straight to the point. It says, by harnessing the data these devices collect, like heart rate patterns, sleep quality, or physical activity, digital health platforms may identify early signs of illness, monitor chronic conditions in real time, enable remote patient management, and support more personalized care. Let's break that down. Digital health platforms may identify early signs of illness, okay? Monitor chronic conditions in real time, okay? Enable remote patient management, okay, and support more personalized care. Okay, so that'll be an oxymoron. If you're having remote patient management, meaning you don't have to be in close proximity, you can remotely, meaning from a far distance, manage this so-called patient, right? But at the same time, it's personalized care. How is it personalized when the person is not even going to be there in person with you? This is the witchcraft that they use I'll be talking about, bro. It's all in the verbiage, And if you're not aware of what the end goal is, you're going to fall for this shit and support it because it sounds good. Oh yeah, this is this. But it's not good, right? It's like a chick that looks good from far, but is far from looking good. The closer you get to her, you be like, oh damn, she look good from afar. But when you get close, you see all the details and you're like, oh yeah, nah. You look away quick. And if you got a brother next to you, you look at him like, did you see that? Or am I the only one who's seeing that? Am I the only one who's bothered by what I just saw? Or we all bothered together? Hey, no. Leave him alone. It's okay. So it says, for example, wearables could alert patients and clinicians to irregular heart rhythms, stress signals, or other health anomalies long before they escalate into emergencies. So tired of these people. It says, but WHO's vision goes well beyond convenience or fitness tracking. Yeah, it's their ambitions are way above that. It says the organization aims to embed digital health into the core of public health systems, enabling remote consultations, meaning you don't got to be in person to get any consultation from one of these fake ass physicians of no value ass niggas, right? Data driven public health surveillance. There you go. And timely intervention. You might want to go watch the movie Songbird. Okay, when they talk about timely intervention, yeah, make a little call for a sneeze, and they declare that you have some type of health or ailment or whatever. They're gonna come grab you from your house and they're gonna take you to an isolation center, right? Remember Remember there was a time where they pushed zero COVID, where if one person had it, everything had to get shut down and locked down until, you know what I'm saying? Remember that shit? Yeah, it's coming back this time, big time. People gonna be very uncomfortable. Okay, it says this is particularly relevant for low and middle income countries. Interesting. Where healthcare infrastructure may be limited, digital tools promise to expand access to care, reduce costs, and help manage outbreaks or chronic diseases more effectively. Yet, realizing this transformation will not be easy. The plan acknowledges a range of challenges, ensuring data privacy, creating interoperable systems across countries, building robust regulatory and ethical frameworks, and making sure digital tools are accessible to all. Right? Cause it all. When they say accessible, they mean everyone. It can reach everyone. Okay, not just to people in high-income countries or urban centers. It says issues such as internet connectivity, digital literacy, and equitable distribution of devices are seen as major hurdles. That's why they got to eliminate the older people, because older people are not too tech savvy. So that's going to be a hurdle that they got to jump over. So rather than jumping over that shit, they're just going to eliminate those older people. Okay? It says to address these concerns, the HUDAT proposes guidelines and standards to ensure quality, safety, and equity. Digital health solutions must be evidence-based, transparent about how they collect and use data, and built with adaptability for different populations. Training health workers and building trust among patients also figure prominently. Without provider buy-in and patient confidence, even the best technology may go unused. Okay? So when they say training health workers and building trust, what they mean is indoctrinating these so-called doctors and nurses so that whenever a patient comes in, right, the trust part that they're talking about is for you to be seduced and coerced into doing whatever it is, whatever therapy that they got for you. Back 4 or 5 years ago, it was a CV jump shot. And my mom was like telling us, she said she went to the hospital for a regular checkup. And the doctor asked her like, "Oh, are you have you been jump shotted? Did you jump shot? You take the jump shot already?" She said, "No, I haven't done it." He's like, "Oh, what you mean you haven't done it?" And he went all berserk, like, "Oh my goodness!" Like she just tore the whole world down. Like, "Whoa, what you mean by that? You haven't?" So he picks up another mask. He straps another mask on. He's like, "Oh, no, unbelievable! You haven't done it? What are you waiting for? Like, this is crazy. Like, I can't believe this. Like, after we're done with this, I don't even need to know why you haven't done it. You should go do it right now. As a matter of fact, after we're done with this blood work right here, you take your ass right downstairs. There's a guy over there. He's gonna do it for you right then and there. You just take one shot. You're done, and that's it. You're good. You keep yourself protected. You keep me safe as well." My mom said, "All right, but you have a mask on. I have a mask on. I'm here for a little checkup. What does that have to do with my jump shot status? Like, what does that do?" He's like, "Oh," she's like, I've already been here. Like, you've already done the blood work and everything. Now you're telling me all this shit. Like, you pretending like you acting like all of a sudden like I'm just contaminated because I told you about this shit now. Like, what the fuck is going on here? So just that inconsistency alone, and his fervent, vehemency on, you gotta go do it right now. If not, you can't leave. Like that kind of shit. She got tight. So she said, "Nah, this is weird. Like, you can't force me to do something that you say is good for me. Like, what the fuck?" So she came home. She was telling us about it. I said, "See, I told you. It's all mind games, bro. See, now, if you're a weak individual, they would have coerced you into going to do it because they get a bonus. They get a bonus. It's incentivized. That's what they're doing now. Healthcare, so-called healthcare providers are incentivized to give you these pills, these medications, all these different things. So they get paid to put you on something that they know is going to kill you. it's going to fuck you up even more. But guess what? Times are hard. So if they're going to get a $10,000 bonus for maybe 10 or 20 people or 100 people that they recommend, you best believe they're going to be going hard as fuck for that. So that's what they mean by training health workers. It's just to indoctrinate them to believe that, hey, if you recommend this to your patients, this is the kind of bonus you're going to be getting. Okay, so it's all incentivized to push this type of narrative and propaganda. That's all it is. All right. So don't take your ass over there. Once again, it says, without provider buy-in, and patient confidence, right? So we have to coerce them. We have to seduce them. That's what it means by building trust. We slowly coerce you into doing it, right? Even the best technology may go unused because most of the time people are not going to opt in for this shit. All right. Most of the time they have to bring it into your forefront. They have to make it seem very important. Oh, this is why you need it. You know, well, we know that there is no problem, but there is a solution for the problem. So here, just take the solution. So you could be prepared. So in case the problem comes, you're still good. Fuck out of here. It says, however, experts caution that it will require coordinated efforts by governments, healthcare providers, technology companies, and global health organizations to meet WHO's ambitious goals while avoiding pitfalls around equity and privacy. In unveiling this global blueprint, WHO signals a new chapter in the fight to make healthcare more accessible, efficient, and responsive, embracing the promise of AI and wearables not only as gadgets, but as instruments of public health transformation. What are they transforming it to? From what it is now to the ultimate CHIP. That's it. Okay? Whether the vision becomes reality will depend largely on how well the world balances innovation with safeguards and how universally these tools are deployed. Okay? Listen to the verbiage. These tools are deployed, man. All right? And then, of course, you have this asshat, right? Dr. Oz, okay? He's ready to pay for trackable wearables in the name of improving your health, right? Let's listen to what these people have to say about this nigga here. It says, under a new initiative unveiled by the Centers for Medicare and Medicaid Services, which is a new one, CMS, right? No more CDC, just CMS. The agency will begin reimbursing health tech companies for wearable devices, apps, and digital health tools, but only if they demonstrate measurable improvements in patient health. In other words, create a platform that we can use to track people's health. If you can't do that, there's no need for you. That's it. Okay? Demonstrate measurable improvements in patient health. Yeah, right. The announcement was made by Mehmet Oz, the CMS administrator. This thing sounds so sinister. That name, Oz, it just sounds like a demon. During an event highlighting the agency's new voluntary payment model. The pilot program, called Advancing Chronic Care and Effective Scalable Solutions, otherwise abbreviated as ACCESS. Ain't that grand. ACCESS. These devils, bro. These devils, man. These devils. Whew. Boy, I tell you. All right. Advancing Chronic Care with Effective Scalable Solutions, abbreviated as ACCESS, okay, is scheduled to launch in July 2026. Under ACCESS, companies that offer telehealth platforms, wearable health devices, or coaching-based digital programs aimed at chronic disease management will be able to apply starting in January. Okay, so telehealth, right? When you go into that word tele, right, the prefix or the prefix tele, it says far or far off. It's a Greek word forming element, right? Meaning operating over distance. Okay, so you have telecommunications, right? Communication over long distance. You have telegram, right? Which is telegraphic dispatch, right? Oh, let me see if I could pull up that word telegram and see what they say here. Telegram. I'm not interested in telegram. It's just an example. Telegraph, right? Telephone, right? Conveying words over a distance, right? Telephone, telescope, right? Being able to see something from afar, right? So it's something that has to do with operating over distance, right? Tele. So when they say telehealth, okay, that means that there's going to be gadgets or devices that are created to work from a distance. So you don't have to physically be there. It can work via some form of apparatus, hence CHIP apparatus, where you can be scanned and they can track your actual real-time data waves, right? Whether it be your brain waves, whether it be your heart, whether it be your whatever, your blood pressure, all these different things can be tracked in real time without you having to physically be in a hospital, right? They can do your blood work, right? Or they could check your stress levels based on wearables. And that's just the stage that they're setting for the implantables. Okay, it's wearables, then implantables. All right, so that's the next step. It says if participating organizations achieve better patient outcomes, right? In other words, it's easier for the people to comply with it, and it's also easier for these tech companies to actually monitor it. They will receive full reimbursement. Upfront funding will be tied to the complexity and risk profile of enrolled patients, while potential bonus payments will depend on outcomes such as lowered blood pressure, improved diabetes control, reduced chronic pain, or better mental health measures. Okay? Initially, the program will focus on several chronic conditions that disproportionately affect Medicare beneficiaries. So if you're on Medicare or you're a beneficiary from Medicare, just remember the CHIP going to be coming for you first. Okay? They're laying out the groundwork now. So whoever is going to be enrolled in this new change, understand that they're going to be the first to be enrolled in the next step. Okay? Including hypertension, diabetes, chronic musculoskeletal pain, and depression. They're going to be able to monitor all that, right? CMS believes that covering digital health solutions may help expand access to preventative care, support ongoing disease management, and reduce the long-term burden on the healthcare system. Physicians may also qualify for a co-management payment. This is what I was saying earlier about how they incentivize people's health. Okay, so it says in a sense of, everyone that they get to, apply for this new trial shit, they get paid for it. It's basically sales, right? So for a co-management payment, if they refer patients into qualifying programs and remain engaged in ongoing care. In other words, make sure you see through it that these people are actually utilizing this new age technology. If they're getting the CHIP, if you're administering it in the hospitals, right? Or if you're the one who's, advocating for them to go and administer it, right? Either or, you get a bonus for it, right? And if you report on it, okay, I got this person, I got 20 people to take the CHIP this week. All right, cool. So that's about $2,000 in your pocket right there. A lot of people are going to do that shit. Doctors are going to be doing it. Nurses are going to be doing it because it's incentivized. Okay. And then in the inner circle, the doctors and nurses, they're going to have them on a leaderboard type shit. So it becomes a competition. So it's not just as incentivized, it's now a competition. So now, I got 30 people last week. How many did you get? Oh, you got only 2 people. You got to come up. You got to pick up the pace. Come on now. You see? So now they don't even care about people's health. They're just worried about, I need to be first, or I need to, make sure I get my bonus because shit, Christmas is coming, or, my kid's birthday is coming up, or whatever. You see? It says the initiative reflects a significant shift in Medicare's approach to health technology. Historically, Medicare has not covered non-medical devices like fitness trackers or digital coaching programs. Access marks a move toward an outcome-driven preventative care model that blends remote monitoring, see that? That's surveillance, digital tools, and personalized support. In other words, everything is your individual information. Personalized support. Like, fuck out of here. By tying reimbursement to actual improvements in health, CMS hopes to encourage innovation while reducing reliance on traditional reactive care. Dr. Oz, that demon, framed the pilot as part of a broader effort to modernize CMS. His stated goals include reducing fraud, waste, and abuse, while also expanding tools that help patients manage their own health more effectively. Whoever asked for this shit? I don't remember last time. I don't know any patient that literally says, "Oh, we need a new technology to help better manage our own health effectively." Like that's just not common practice. I don't care what country you're in. Nobody's really worried about that. Like, oh, find a better way for me to manage my health. Like, it's like, what are we talking about here, right? But here's the key. This is their stated goals includes reducing fraud, waste, and abuse. That's all about cutting costs. That's all about money making. It's a business. Okay, that's a business model right there to save money. Every corporation does that shit. How do we cut back? How do we cut costs? Well, we got to look into preventative measures. Fraud, waste, abuse. These three things. If we can figure that out, that's a lot of money that we don't have to lose right there. Right? Most corporations and companies all have the same philosophy. Okay, and then the people get effed at the end of the day. Right? At the end of the day, the people get effed. It says the agency is positioning this program as a step toward a future where digital health solutions are integrated into mainstream care and evaluated based on their real-world impact. Okay? So basically what they're saying is they're about to take the next step. All right? The next step, which will be wearables, which then leads into implantables. All right? RFK said a few months back that in the next 4 years, all Americans will be wearing wearable track technology to track their health. And that just happened to be exactly what the WHODAT is doing and exactly what Dr. Oz is doing. Okay? And he has been a proponent for the CHIP. So him pushing this wearable shit is like, it's very phony. Dr. Oz, if you're listening, you're a phony ass nigga, along with all these niggas that work with you. Y'all niggas is all phony. All right? That's why the scripture says what it says. Let's get that real quick. In the book of Job. All right. Y'all all phony, man. You know exactly what you're doing, but you lying to people, telling people, it's about wearables. Like, that's going to do something. You know damn well that's not the end goal. You know damn well it's designed to be flawed. All right. So you can open up the door for you to bring in the C-HIP. You know that. If you said that shit, that is the brand new cutting edge technology of health in the future. Fuck out of here. Job 13 and verse 4 says, but ye are forgers of lies, ye are physicians of no value. Point blank, period. All right? You're a physician of no value, so nobody should ever take you niggas seriously, man. You just hide and put that name expert or that title expert in front of you, your name, making it seem like you're credible. No, you're not. No, you're not. All right? No, you're not, man. Okay? And the scriptures say what they say. So let's get this back in Ecclesiasticus 38. All right, and then we're going to close it out. Verse 1, it says, honor a physician with the honor due unto him for the uses which ye may have of him, for the Lord hath created him. Okay, so the physician, you got brothers that are in the truth that are actual physicians, man. They know about the herbs, they know how it affects the body. Whatever ailment you may have, brothers got a cure for it through the spirit and power of Yahweh Bashim Yahushua. You don't got to waste no time and money going to these fucking Dracula, kitchen. All they want to do is suck your blood. Like, damn. Right? Verse 2, it says, for of the Most High cometh healing, and he shall receive honor of the king. Okay, so you go to Dr. Oz, you're not going to get no healing from there. All right, you don't get healed when you go to these fucking Asclepius medical centers, so-called medical centers, man. All right, these are priest of Baal centers. Okay, it says the skill of the physician shall lift up his head, and in the sight of great men he shall be in admiration. The Most High hath created medicines out of the earth, and he that is wise will not abhor them. Okay, so if you see somebody going to the hospital for a little petty shit that you can use herbs to cure, you look at them as unwise. Because like, why are you going to the hospital for? I have anxiety, so I'm gonna go take pills for anxiety. I think you just got demons on you. Fast and pray, and they're gonna go away. You know what I'm saying? But they don't even believe in that, so of course it's not gonna work. They'd rather believe in the placebo than the actual spirit of Yahweh Bashim Yahushua to do something for them. Okay, it says verse 5: was not the water made sweet with wood, that the virtue thereof might be known? And he that giveth, and he hath given men skill, that he might be honored in his marvelous works. With such doth he heal men, and taketh away their pains. Okay, of such doth the apothecary make a confection, and of his works there is no end. and from him is peace over all the earth. My son, in thy sickness be not negligent, but pray unto the Lord, and he will make thee whole. It's just that simple. Okay? It's just that simple. And don't let your mothers or your grandmothers or your wives be all that dramatic shit to get you in trouble. Don't do that shit. Tell them, listen, I'm not going to no hospital. I'm going to stay home. The Lord's going to heal me. That's it. And leave it alone. Okay? Leave it alone. Oh, you got to go to the hospital. It's getting worse. If you don't go to the doctor, you got to go to the emergency room and let them check and see what's going. Shut up. The Lord's got it. All right? It says, leave off from sin and order thine hands aright and cleanse thy heart from all wickedness. Give a sweet savor and a memorial of fine flour and make a fat offering as not being. Then give place to the physician, for the Lord hath created him. Let him not go from thee, for thou hast need of him. Okay? So that's all you need to know, bro. Okay? That's all you need to know. Fasting, praying, and then dealing with the herbs. All right? And the Lord's going to take care of the rest. Okay? Don't listen to Dr. Oz and his bullshit. Don't listen to the Ghebreyesus and his bullshit. Don't listen to the CDC and their bullshit. All right? They have nothing to offer besides death. All right? Besides death and destruction. So don't listen to whatever the fuck they got to say. All right? Keep your faith in Yahweh Ba'ashem Yahushai. He was there before they got here. All right? Yahweh Ba'ashem Yahushai was always there before these devils popped up on the scene. So don't listen to what they got to say. And if you do, that's on you. All right? If you do listen to what they got to say, that's on you. All right? So anyway, I'm going to end it off there. Lord willing, you're edified and informed. In closing, I'd like to give all praises, honor, and glory to Yahweh, Bahasham, Yahushai, Bahasham, Ruach HaKodesh, the water Yahweh, Bahasham, Yahushai, and until next time, Shalom.